So the benefits of feeding a fat-restricted diet are most pronounced for patients with conditions that are fat intolerant. When I think of fat intolerant conditions, I think of hyperlipidemia, pancreatitis, and then lymphangiectasia or protein-losing enteropathy. Most other GI conditions do not require fat restriction, and fat restriction can actually be a little more difficult in those cases because they have to eat more of a fat-restricted diet. Fat is the most energy-dense nutrient, so if you feed a high-fat diet or higher fat diet to a patient with gastrointestinal disease, as long as it's designed for GI disease, then it may help reduce meal volume, which can be beneficial. So I don't recommend feeding a fat-restricted diet to every patient with GI disease. I focus more on the patients that have those conditions that benefit from fat restriction, and I try to use a more tailored diet for patients that don't need the fat restriction. However, there are a lot of benefits for patients that have hyperlipidemia, pancreatitis, or lymphangiectasia. A fat-restricted diet may manage their disease alone. It's rare with, especially with lymphangiectasia, that you don't need medications in addition to diet, but it can be really helpful in the management of those conditions. The other thing I would say is if you have a patient that has pancreatitis and they have a housemate, the low-fat diets are formulated for adult maintenance. The fat level is above AFCO minimum, so you don't have to worry about feeding a fat-restricted diet to a healthy dog or a dog with another type of GI disease in most cases, provided they're getting adequate calories. They are totally appropriate as a maintenance diet. It's just unnecessary in some cases, and it may make it more difficult to get adequate calorie intake. So in general, cats and dogs are different when it comes to feeding fat-restricted diets. Most cats do not need fat-restricted diets, even when they have pancreatitis. I may avoid a very high-fat diet for cats with pancreatitis, but I think about fat-restricted diets being more important for dogs. So usually I get a lot of questions about what is a fat-restricted diet, how much fat is fat-restricted, and I generally consider less than 25 grams of fat per 1,000 calories of food as a very low-fat diet. If it's under 20 grams of fat per 1,000 kcals, then I'll consider it an ultra-low-fat diet. Both would be appropriate for kind of first-time pancreatitis patients, or maybe they got into turkey skin or whatever. They got into something that made them sick in terms of pancreatitis. For the more chronic patients, I do try to go with the ultra-low fat, so below 20 grams of fat per 1,000 calories, and that helps ensure that they're still getting enough fat, but not getting more fat than they need. So I also get a lot of questions about whether a weight loss diet is appropriate for patients that need fat restriction. And that would include weight loss diets, therapeutic weight loss diets, or more retail, pet store available, light or weight management diets. Now, I typically don't recommend feeding a weight loss diet or a weight management diet for patients that need fat restriction due to GI disease because of the fiber content of weight management diets. Most weight loss and weight management diets will have a significantly higher fiber content than a gastrointestinal diet that's low in fat, and that may impact diet digestibility. So especially for patients with lymphangiectasia or severe pancreatitis, I would worry about the digestibility of the diet overall and whether or not the patient could utilize the nutrients in the diet. Now, if the patient is hyperlipidemia and they're overweight, I think a weight loss diet would be appropriate, provided it's low enough in fat. Some of the weight loss diets are actually slightly higher in fat than the low-fat GI diets because you're feeding fewer calories, so they're more concentrated in nutrients, and that would include essential fatty acids. So you would have to make sure that a weight loss diet was comparable to a low-fat gastrointestinal diet prior to feeding it to a patient that really needed fat restriction. But the main difference is the digestibility due to the fiber content in weight management and weight loss diets. So the length of time that a pet needs to be, or dog especially, needs to be fed a fat-restricted diet will depend on the condition, but in many cases, lifelong fat restriction is necessary. I think about acute pancreatitis patients. If they have never had pancreatitis before, and they also, you know why they got pancreatitis because they ate something out of the trash or whatever, and they don't have hyperlipidemia, then I may consider switching them back to a moderate fat diet later on. I'd say they need to be fed a fat-restricted diet for at least a couple weeks, if not longer, before doing a very slow transition back to a moderate fat diet. I wouldn't feed anything too high in fat after a pet's had pancreatitis, even if it was the first time. I would make sure that it's moderate fat, and I would make sure to do a 2-week transition. But for pets with hyperlipidemia and lymphangiectasia, those are chronic conditions that require lifelong fat restriction. So a lot of these patients end up having to be on the low-fat diet long term, and that can create issues when they develop health issues later on in life. So if they get chronic kidney disease and they're on a fat-restricted diet for hyperlipidemia, there's not really a commercial diet option out there. So you would have to consult with a board-certified veterinary nutritionist in order to get the best diet recommendation for those pets. So the biggest contraindication to feeding a low-fat diet, if it's not really indicated for the patient, is that it's going to be harder for them to gain weight if they need to, or maintain their weight if they're at ideal body condition. Low-fat diets are pretty low in energy density because fat is so high in energy density. If you're restricting that, then the calories in the diet tend to be a little bit lower. And I would want to make sure that the pet is able to maintain weight or gain if necessary. So I don't recommend feeding a low-fat diet to GI patients that are underweight, that don't have one of those 3 conditions that I mentioned, hyperlipidemia, pancreatitis, or lymphangiectasia. If they have just a chronic vomiting or some other condition that requires a GI diet, I may consider something a little bit higher in fat. And that's because I would want to make sure that they're able to maintain or gain body weight. The thing I would think about when I'm recommending a fat-restricted diet is it the best diet for this patient? I like to think that we make individualized pet recommendations, and if the pet doesn't need a fat-restricted diet and there's not a good reason to feed it, like someone in the household, one of the other pets is eating it, then you don't need to go to a fat-restricted diet for every GI case. So I would make sure that you're individualizing your nutrition recommendations for gastrointestinal cases. In some cases, low fat is indicated and totally appropriate. In other cases, it may not be harmful, but it may not be the best option. So you want to make sure that you're tailoring your recommendation to the patient and their problem list.